When people hear the name Whitman-Walker, they might immediately think about care for the LGBTQ community and HIV care and prevention. But primary care is an essential part of the Whitman-Walker care model. And joining us to talk more about some of the services provided at Whitman-Walker is Dr. Stephen Abbott, Medical Site Director of the Max Robinson Center, and Dr. Terrence Whedon, Staff Adolescent Medicine Physician. Thanks to both of you for joining us. We appreciate it.
Thank you for having us.
Let's start off by talking a little bit about primary care at Whitman-Walker and the types of screenings and immunizations that your team provides for anyone from ages really 10 to 100. Tell us a little bit about some of those services.
So we are a federally qualified healthcare center, which means we're committed to community health and wellness and caring for the folks that live in the neighborhood where we live. So primary care encompasses routine screenings like diabetes, hypertension, depression, substance use disorders, and STIs, including HIV, gonorrhea, chlamydia, syphilis. We are committed to providing quality care to the community, whether you're HIV positive, HIV negative. We have treatment programs, prevention programs, whether you're LGBTQ identified or not. We have a wide variety of patients that come to us for care, all under the umbrella of primary care. So although we provide specialized care in some very specific areas, like HIV, gender-affirming care, substance use disorder, we assume the primary care responsibilities for everybody that we see, regardless of why you're there. So you may be coming to us for HIV care, but we are going to also take care of your diabetes, your high blood pressure, your mental health, and recommend any routine screenings that are recommended by the United States Preventative Task Force. So mammograms, colonoscopies, immunizations, including COVID, and what am I missing?
COVID and flu vaccines as well. We also have a building our dental program as well.
Okay, lots of services.
Yeah.
And as you said, you don't have to identify as part of the LGBTQ community.
No, not at all. We have patients who've been coming us for decades since we first opened in east of the river in 1993 who came in for various reasons, are not LGBTQ identified and aren't HIV positive, but come to us because we provide excellent care in a warm, judgment-free setting.
Dr. Abbott, Whitman-Walker wants the community to know that it's a place for seniors as well, which I don't think a lot of people know about, and those on Medicaid and Medicare. Can you talk a little bit about that, and are there any special programs that seniors should know about?
So thanks to advances in healthcare, not just in HIV medicine, but in healthcare overall, early screenings, interventions, and treatments, people are living longer in most of the city. Unfortunately, that's not true in Ward 7 or 8, where the mortality rate is a little bit higher, life expectancy is lower. But part of that is due to the fact that folks aren't getting screened or getting their diabetes under control or getting their blood pressure under control. Some of the programs we have focuses in on basically LGBTQ seniors and what it's like to age in that community, as well as, behavioral health and support groups for people who are aging, elderly, sometimes feel a little bit isolated. So we're building community within our community to help support those who are getting older and may or may not have support from family and friends.
Dental care, you mentioned it earlier, Dr. Whedon, has greatly expanded at Whitman-Walker. Can you tell us what type of care patients can get there?
Yes, and I'll have Dr. Abbott speak a little bit more about that, but the dental program provides dental care for ages as young as 13, all the way up.
So we do routine cleanings, screenings. We have a beautiful 8-room dental suite, 3 dentists. They will do everything from routine prophylactic care to extractions, fillings, and apparently we also do Invisalign, which I just learned today.
Oh, that's interesting. That's great, especially for the younger demographic. Whitman-Walker recently lowered the age of patients being treated, as we said, to 10 years old. I don't think people know that. And there's a new adolescent medicine unit now. First, can you explain what adolescent medicine is all about? And then tell us what types of services are available for young people, teens, and even young adults.
Sure. Adolescent medicine is essentially a specialty focusing on teens and young adults. So we really want to capture that age because a lot of healthy habits and unhealthy habits start at that age. And so if we capture that age group, start getting routine physicals, sports physicals, immunizations, things like that, we want to prepare them for the future, essentially.
Interesting.
Yeah.
And have you seen the younger demographics start to roll in a little bit?
They're starting to, yeah.
Yeah.
Yeah, definitely.
And it's a welcoming environment physically, even for kids. Nobody loves going to the doctor, sorry to say. But is it the type of atmosphere where a child as young as 10 years old can come in with, a caregiver and feel comfortable there?
Our motto at Whitman-Walker is "We see you." So that's the type of environment that we want to portray to people and to include that audience. And as soon as they walk through, my clinic door, they feel seen. And that's my goal is for teenagers and young adults to really feel seen and feel heard. It's difficult being a teenager and a young adult nowadays because they're so exposed to so much right now,
Yeah.
Especially in today's world. So it's important for them to feel seen, feel heard, and feel validated.
And so the services are obviously, there are medical services that they deliver. Are there mental health services as well?
Correct. So encompassing all the services, we have mental health services, we have child and adolescent psychiatrists as well. We also have behavioral health specialists as well. So that's kind of the mental health side of things. The medical side, we do vaccines, immunizations for COVID and flu, also HPV. Any of the childhood routine vaccinations that were missed, they can get those done as well.
Wonderful.
In addition to confidential access to birth control and also STI testing.
Important stuff. You probably are aware that the Washington Post recently reported that half of DC's Black residents lack access to easy medical care, and Black residents live on average of 16 years less than their white counterparts in Ward 3. How is Whitman-Walker working to be part of the solution of this huge health disparity?
So we're in the community, committed to the community. We've been in Ward 7 and 8 since 1993 with our first clinic. And really with the expansion into our new clinic, we're going to be able to service from 5,000 to 15,000 people, so 10,000 more people than we were seeing previously. And that's really why we want people to understand that we're here for everyone. You should not have to travel across wards to get health care. And in that same article you referenced, they talk about how folks who live in Ward 8 aren't going to clinics in Ward 8 because of trust issues. So we're hoping with time and exposure and experience, people will start to come to us routinely. We'll also start offering some same-day services beyond what we've offered before so that folks don't have to go to urgent care. They can come and see us if they're an established patient rather than waiting in the ER, which often people will do. We want to decrease the barriers to care, increase access, and continue to provide the quality of care that we've been giving. And so far, as we've expanded into our new space, people who have been our patients for decades are starting to recruit their neighbors. And it is such a warm feeling to see people come in to introduce their clinic, because it really is their clinic. It's not our clinic, it's their clinic, to their friends, family, and now their children. So we will have the capacity to see more people, and we can start decreasing some of these statistics. It may take a while, but we are there to do it, and we're not going anywhere.
That's great. What do you think overall makes Whitman-Walker stand out as a healthcare home for people living in the DC region?
The reason why I work there and the reason why I am a patient there is because, as Dr. Whedon was saying, our motto is "We see you." No matter who you are, you're going to get quality care. You're going to be listened to and respected, and you'll be able to be yourself in ways that I have not experienced in other clinics. Oftentimes people don't disclose things that are going on in their lives because they don't feel comfortable with their provider. And we go through extensive training. We hire from the community. We have providers who live in the neighborhood. We have many providers who are queer identified, running the age gamut. We have young folks, old folks. We are the people that we treat, and I don't think that many other places have that same vibe, that same feeling.
You know, I think a lot of people, when they go to the doctor, they feel very rushed. Mm-hmm. And I think that time, you know, is often dictated by, you know, other factors in a normal medical setting. Do you feel like there's a little bit more time and attention paid to individual patients as compared to other places?
If you have a 20-minute visit with somebody who actually takes the time to ask how you're doing and listen to your response, it doesn't feel like 20 minutes. Mm. I think all of us strive to do that at every level in the clinic, to actually slow down and listen. Yes, we fall behind. Yes, we see lots of complicated medical conditions, but we're still going to provide care with compassion and caring that I don't think you get elsewhere.
Right, and when you're doing the work, it doesn't feel like 20 minutes at all. It goes by so fast.
Yeah, exactly. And you guys can refer to other doctors in the mm-hmm. in the building and
Correct.
In the practice. Mm-hmm. So if you see something that, you know, you think Dr. Whedon would be mm-hmm. better equipped to handle, there's a lot of cross-pollination.
Yeah, there's lots of expertise in-house that we will often access if we have a question that we're not able to answer on our own.
Wonderful.
It's very collegial. It's very friendly in terms of sharing each other's knowledge.
Yeah, during my job search, kind of alluding back to the question you asked, I was very intentional about where I wanted to work, kind of serving the community that I identify with, mm-hmm. that look like me, that identify as me. So I was very intentional, and I don't think I would have found that in any other place to work. So fair to say, you know, Whitman-Walker is a special place.
Feels like home, it sounds like.
Yeah.
Great. Thank you both. I appreciate it. If you'd like more information, please visit whitman-walker.org. Or you can go to WTOP.com and search Get on Top of Your Health. I'm Deborah Feinstein. Have a great day.